Michael, thank you. Well, June is Prostate Cancer Awareness Month, and according to the American Cancer Society, more than 2 million men in the U.S. are prostate cancer survivors. Last year, an estimated 23,000 men in Oklahoma were diagnosed with the disease. Luckily, we've got Dr. Jag of the Cancer Treatment Centers of America. He's here to discuss some myths associated with prostate cancer. Dr. Jag, thanks for stopping in. I wish we could talk about baseball or something right now, but this is much more serious.
Yes.
The first myth deals with age. A lot of people think it's older men, much older, 70 years or older. That's not true.
That's not true because actually you will see that there are men who develop prostate cancer in their 40s and 50s. So it makes it very important that you should be screened and make sure that you have your physical exams, because those that are found with prostate cancer earlier can be much more aggressive than those found with it later.
So this kind you find in earlier males actually is the kind that could be much more aggressive.
Yes.
The second myth, talking about symptoms. And honestly, I think I'd be hard-pressed to find a lot of people, even on the street, that could identify the main symptoms of prostate cancer. So this is important that you tell us what these are, so if you are in your middle-aged male, you know what to do.
Right. The symptoms can be quite varied. So anything from erectile dysfunction, blood in the urine, blood in the sperm, blood in every time you have a bowel movement or something like that. Those things can be very bad signs of prostate cancer.
Again,
itself.
Dr. Jag, a tough interview to eat breakfast during.
Yes, it is.
Okay, but luckily we do have a visual here. We're going to call this the Fox 23 prostate cam. Is that right?
Yeah, yes, we can. And here's an example of the prostate. It's right down here. It's a walnut-sized organ right below the bladder itself. And what you're looking at is a very small tumor inside the prostate itself. So this may not cause any signs or symptoms of any disease. But when it becomes large enough, what happens is that that tumor itself can close off the seminal vesicles and the urethra, leading to the symptoms that you experience. So blood in the urine, blood in the semen, and those things as well can be early signs, if not urinary incontinence itself.
Scheduling a prostate exam, not exactly a date on the calendar you probably circle and look forward to, but we talk about the symptoms, and now we'll talk about the treatments of treating prostate cancer. A lot of myths associated with that as well.
Right. So people think that only surgery and radiation are the common tools available. Well, the FDA recently released 2 medications or 2 therapies that are available for those with advanced prostate cancer. The first one is called Provenge. So if we consider this apple as a prostate, it looks like a prostate, but
our fake onset apple, finally a use for these here. Okay.
So we have, what we do is we work with the Oklahoma Blood Institute and the American Red Cross to extract white blood cells from your bloodstream.
Not actual size, though.
Not actual size, obviously. Right. So what we do is we send this to a company called Dendreon, and then what they'll do is they'll prime these cells. They'll train them and program them to seek out and destroy prostate cancer. So after they've been programmed, these cells we then re-inject back into your system, and they go directly to where the prostate cancer is located. The survival is improved with this therapy, and these are one of the most, this is one of the most fascinating tools that's been available, because it's a vaccine almost against prostate cancer.
Doctor, we have to wrap things up, but again, you see the medical advancements, things really moving in the right direction here.
Yes.
Dr. Jag, thank you so much for joining us this morning. Appreciate it. For a link to Dr. Jag's blog, we provided a link at our website, fox23.com. Just click on the Fox box. All right, the time